When we say basic sciences, what do you actually mean by basic sciences?
The word basic should be more interpreted as a foundation. So these are the foundation sciences, as it were, which are going to be needed for the practice of anesthesiology and intensive care. So what we mean is the candidates, the future anesthetists, have to have a good grounding in topics like physiology, pharmacology, both general pharmacology and specific pharmacology of the individual medications, anatomy, physics, chemistry, biochemistry as applied to our practice, and so on.
I understand about the importance of clinical sciences, but what about sciences like physics? Why do anesthetists need to know any physics at all?
My obviously biased opinion, every doctor should have a good knowledge of physics, but more so if you're an anesthetist, because our work is intrinsically involved with concepts like gases, so you have to know about pressures, about flows. You have to know what are, for example, solubilities, partition coefficients, because these are important in your clinical practice. Physics is not just obviously about gases and fluids, but these concepts also are involved, for example, in blood pressure control, basic electricity, because a lot of the machines we're using are obviously electric and they can have some faults, and we have to know sources of error and how to quickly continue our case.
Why do we as anesthetists need to know the basics of pharmacology? We're not pharmacists. What do we know? Why do we need to know pharmacokinetics and pharmacodynamics of drugs?
If we as anesthesiologists, we should consider ourselves scientists first of all. We're not just technicians who somebody hands you a syringe and you just empty it into a vein. I mean, anybody could do that. When you use a drug, you're first of all responsible for its choice, so you have to know why you're choosing it, why is it the best in the circumstances. You have to know its risk-benefit ratio, and of course you have to know how it works in the context of the patient you're dealing with, because obviously you have the normal adult male, but the normal adult male rarely comes for an operation. If you need a surgical intervention, normally it's because there is some disease process. So you have to know the background of how that disease or condition or trauma is actually changing the physiology of the patient, the volume of the blood, for example, so that would affect volume of distribution and elimination and so on. So yes, you do need this general pharmacology apart from the specific pharmacology of the drug using to predict and to get the best outcome of what you're injecting, what you're using.
Perhaps can I ask you about your particular involvement? Which kind of lecture you're delivering? I think it's something to do with electrolytes and fluids. Can you tell me a little bit more about why is that important?
It is one of the perhaps most mundane topics. We probably all have learned it as one of the first physiology lectures at medical school. But from our experience, a lot of candidates who come for the exam have either forgotten it or have confused the concept. So when you ask simple things like what's the volume of intracellular fluid as compared to extracellular fluid, for example, and what are the normal ranges of calcium or magnesium and why are they important to the anesthetist, often they sort of hesitate or have forgotten everything.